One of the things that has certainly been disappointing, distressing for many people in healthcare is the amount of record keeping that they have to do. I remember when I was working in hospice that when I first started working in that field, this was back in the mid 80s, we would do time studies, and we found that the average nurse or social worker was spending about 10 or 15% of his or her time in record keeping. The latest time study I've seen of people, even in hospice, they are now spending between 50 and 60% of their time in record keeping. More time in record keeping than with patients. And I like to get away from that trend before it gets even worse than what it is now. And so I talk to people about a one sentence care plan. The only thing we need to ask a client is, what do you want? That's the same question that needs to be asked by counselor, social worker, chaplain, no matter what your role is in healthcare. All you need to say to someone is, what do you want? Or another way of saying that, given our relationship, whatever our relationship might be, chaplain to patient, social worker to patient, whatever our relationship, what do you want from that relationship? There was a man named Zach, and Zach was a workaholic. He was a realtor. And the only way that Zach relaxed was fantasizing with his teenage son, Michael, about a trip that the two of them, a canoe trip that the two of them would eventually take together in northern Minnesota. And they would often sit together and fantasize about that canoe trip. Michael, Zach's son, died in an automobile accident along with some other teenagers. Zach immediately went to counseling. The counselor said to Zach, what do you want? What do you want? And Zach said, there's several things I need, most of which I know you can't give me. One, I need Michael back. Two, I need to somehow go with him on that canoe trip. Three, I'm a workaholic and I need to somehow now realign my priorities. Those are the things that I need. And I know you can't give me much of that. The counselor responded by saying, let's try. The counselor said, I want to make this suggestion and I want you to do it. And I don't care what it takes, but you need to do it. He said, whatever it takes, I want you to take off 2 months from work. The first month, I want you to get a kit and build a canoe from scratch. That's what you're going to do the first month, is build a canoe from scratch. And on the side of that canoe, in big letters, you're going to put the name of that canoe, and the name of that canoe will be Michael. The next month, I want you to go up to northern Minnesota and I want you to canoe. And each day after you've canoed, I want you to write in a journal a letter to your son on what you experienced that day and how you're planning on realigning your priorities from now on. Michael followed that care plan. At the end of those 2 months, he felt he had done something, he had done something, which was very important. He felt he had been with Michael. He felt he had gone on that canoe trip and he had realigned his priorities. So all we need to do is to make that one question. And even though people might have what they think are impossible expectations, we just need to adjust whatever our answer is to those expectations, address those expectations, meet their care plan. And that's all we need to do to fulfill a client's desires and needs.